Hello to everyone in France. I'm Angela Cadogan, physiotherapy specialist, and today I'd like to talk to you about the diagnosis of shoulder pain. Now, this is a huge topic and it's become incredibly complicated over the years. So today I'm going to focus on the 5 important diagnostic categories that we need to be aware of when seeing patients with shoulder symptoms. The problem for physiotherapists is that shoulder symptoms can be caused by a wide variety of conditions, ranging from cancer through to mild bursitis. So it's important that we get the right diagnosis so that we can get the right patient to the right treatment at the right time. The first important category of patients to identify are those with red flag indicators of serious medical conditions, such as infections, bony tumours, and systemic inflammatory diseases like rheumatoid arthritis. And those patients need to be referred for medical assessment to get the right treatment for their condition. The next main category that we need to identify are those patients who have had traumatic injuries, such as a fracture or a dislocation or an acute rotator cuff tear, and these patients may need to see an orthopedic surgeon to have surgical treatment for their injury. And there are certain traumatic conditions that need early surgery in order to achieve the best outcome. So it's important we identify these conditions. The next category are patients that have pain that is felt in the shoulder region but is referred from somewhere else, such as the cervical spine or the thoracic spine. To identify these patients, you need to perform a thorough cervical spine and thoracic spine evaluation, and if the symptoms are arising from the spinal condition, then the treatment is directed at the spinal problem. Now, once we've excluded serious medical conditions, traumatic injuries, and referred pain, we can then start to look at, does the patient have a specific local shoulder problem? And this is where it's got really complicated. Our clinical tests are not very good at identifying specific pathologies in the shoulder. So we can't use one test to decide whether the patient has a rotator cuff tear or an AC joint problem. Our clinical tests just lack enough accuracy to enable us to do that. But what we can do with our clinical examination is to classify patients into one of 4 main categories: the unstable shoulder, a stiff shoulder where they have a loss of passive range of motion, a rotator cuff problem where they have pain with rotator cuff testing, or an AC joint problem. Now, within each of those categories there are more specific shoulder pathologies, but our clinical tests can't identify those specific pathologies. So sometimes we do need to use imaging such as X-ray and ultrasound scan to help us make a more specific diagnosis where this is going to change our treatment. Now, there are some patients for whom it is not possible to make a specific diagnosis. And that's okay. We can still treat these patients as long as we have excluded a serious medical condition, a traumatic injury that needs surgery, referred pain from the cervical or thoracic spine, and specific shoulder conditions. So those patients where we don't have an accurate diagnosis, we can treat them with a symptom modification or impairment-based treatment approach. Within that group, we also need to be aware of patients who may have persistent pain driven by something like central sensitization, as those patients also may need a specific type of treatment. To summarize then, we need to be able to identify patients with red flag indicators of serious medical conditions, traumatic injuries that need early surgery, pain that's referred from the cervical or thoracic spine, identify a specific shoulder condition where there is specific management for that condition, and also identify patients who may have a persistent pain presentation and need a particular type of pain management program. I cover all of this in much more detail in my e-learning modules that cover the diagnosis and management of shoulder pain. So if you're interested in learning more, you can sign up for my e-learning modules through the Agents EBP. Thanks very much, and I look forward to seeing you on the courses.